Assalamu alaikum. Hi everyone. In this video, we will discuss resin infiltration technique, markedly known as ICON, its importance and uses in dentistry. So, resin infiltration technique is a novel technology that bridges the gap between prevention and restoration of a carious lesion up to the first third of dentine and can camouflage aesthetically disfiguring white spot lesion on the buccal surface. It is marketed under the name ICON and is described as micro-invasive technology that fills, reinforces, and stabilizes demineralized enamel without sacrificing the healthy tooth structure. Resin infiltration was developed as a technique to treat enamel caries. The histopathology of enamel caries occur as acid dissolves intercrystalline spaces within enamel. Since the outermost 10 to 30 micron of enamel is more resistant to dissolution from presence of fluoroapatite, a more porous subsurface forms. The principle of resin infiltration for a caries arrest is to occlude the porosity formed during the caries process and prevent the pathway for acid to further dissolve the tooth structure. The two basic steps to achieve this goal are to remove the less porous surface layer of enamel and allow resin to infiltrate the internal enamel porosity through capillary movement, as the surface of a carious lesion may act as a barrier to resin infiltration. Several preliminary studies evaluated different acid dissolution for removal of surface layer. A solution of 15 hydrochloric acid applied for 90 to 120 seconds was shown to almost completely remove the 45 micron thick surface layer of lesion. After removing the surface layer of the carious lesion, the next step is to infiltrate resin into the porosity created during the solution of intercrystalline enamel. Unfilled resin infiltrates have been shown to penetrate deeper into carious lesion than dental adhesive, and triethylene glycol dimethacrylate resin infiltrant was shown to penetrate deeper than other formulations of infiltrant. When applied for 3 minutes, the ICON triethylene glycol dimethacrylate-based infiltrant was shown to penetrate 14 and 400 micron into non-cavitated interproximal caries lesion. The visual change in enamel that arises from enamel caries is due to the ear presence in the subsurface porosity. The opaque appearance of white spot lesion occurs because light is scattered within the body of the white spot lesion. Light scattering is caused when light interacts with two substances with different refractive indices. The refractive indices of enamel is 1.62 to 1.65 is different than that of air, which is 1. Infiltration of the lesion with an infiltrant has a refractive index of 1.52 is able to mask the lesion. Infiltration has also been shown to infiltrate hypomineralized enamel of non-carious developmental origin. A laboratory study reported infiltration to an average depth of 0.67 plus minus 0.39 millimeter in hypomineralized enamel lesion. Interaction polymerization inhibiting substances such as a product containing eugenol, temporary cement must not be used in combination with this material. So, this technique is used to treat only white spot lesion that reach only the outer one-third of dentine. So the icon technique is used to treat enamel caries in outer and inner half and outer one-third of dentine caries white spot. This is occur almostly after orthodontic treatment or in developmental defect. So we have this case about icon technique. Before and after. We will discuss this case in details, how the technique was done. Firstly, we have this case with a multichromatic spot in the enamel of a patient. We know that this technique only treats the white spot, not the chromatic spot. So we must do a home bleaching for a patient and with 16% carbamide peroxide tray-based home whitening for 14 days. Then we will have this result. After 2 weeks of whitening, appointment was done, and firstly we do isolation with rubber dam. We use 15% HClH hydrochloric acid for a 2 minutes with a gentle scrubbing motion into the teeth. Etchant thoroughly rinsed and tooth dried. The immediate frosted appearance of the teeth, which localized white patches still visible. After that, we apply of Icon Dry, which is 99% ethanol. This has two functions: to dehydrate the teeth to maximize infiltration, but also test drive of what the tooth will be look like once infiltrated. Appearance of a teeth with Icon Dry in place, shown some masking of white spot, but not completely. We do a second 2 minute cycle of etching, this time covering the entire label surface as the ethanol stage shows cervical white patches. Cycle completed and test drive with Icon Dry, which is 99% ethanol. Note that the central have been masked completely. However, there are still some patches on lateral and canine. Third cycle with a different etchant of the lesions that require an additional erosive cycle. Final test drive showing complete masking of a previous white spot. Resin infiltration step: application of triethylene glycol dimethacrylate resin for 1 minute as a scrubbing motion, followed by a period of 2 minutes to allow the resin to penetrate into the exposed enamel prisms. Excess resin is blotted dry. All of the contact points are flossed and critically, each tooth is lightly cured perpendicularly to the surface for 40 seconds, not 20 seconds like composite, but 40 seconds. This step is repeated with another layer of resin infiltration being placed, and again cure for 40 seconds for each tooth. The infiltrant in an infilled resin which undergo significant shrinkage. Therefore, to counter this, we reapply the resin infiltrant and recure with the same process. After that, final cure for 20 seconds on each tooth under oxygen barrier medium, which is glycerin gel. The immediate post-operative pre-polishing protocol using medium and fine polishing spiral, and polishing protocol using medium and fine polishing spiral, another wheel, and we have final high luster polish using glossy dip paste, immediate post polishing high luster, immediate post operative result. And this is the final result, pre and post operative result. Thank you for listening.